Multiple choice questions, part 2. The Ghon complex is associated with childhood tuberculosis, adrenogenital syndrome, Uveoparotid fever, histiocytosis. The correct option is childhood tuberculosis. White interlacing lines, which are also called as striae of Wickham on the buccal mucosa, are characteristic clinical feature of Leukoplakia, Lupus Erythematous, Lichen planus, Carcinoma in situ. The correct option is Lichen planus. Osteosarcoma may develop in cases of Osteopetrosis, Osteogenesis imperfecta, Acromegaly, Osteitis deformans. The correct option is Osteitis deformans. In an early carious lesion, the first structure to show evidence of destruction is enamel prism, cuticle, inter-prismatic substance, lamella. The correct option is inter-prismatic substance. Features of multiple skeletal radiolucencies, reversed albumin-globin ratio, Bence Jones proteins in the urine indicate a diagnosis of metastatic prostatic carcinoma, multiple myeloma, hyperparathyroidism, biliary tuberculosis. The correct option is multiple myeloma. Histiocytosis X includes all except little sweet disease and Christian disease, eosinophilic granuloma, giant cell granuloma. The correct option is giant cell granuloma. Irradiations to the head region doesn't include xerostomia, osteoradionecrosis, radiation carries Ramsay-Hunt syndrome. The correct option is Ramsay-Hunt syndrome. All of the following developmental cysts of jaw present as radiolucent lesions except median palatal cyst, nasopalatine duct cyst, nasoalveolar cyst, globulomaxillary cyst. The correct option is nasoalveolar cyst. Vesicles or bulli of the mucous membrane or on skin are seen in all of the following except herpes simplex, herpes zoster, agranulocytosis, pemphigus. The correct option is agranulocytosis. White lesions of the oral mucosa are characteristic of the following except hyperkeratosis, leukoedema, lichen planus, median rhomboid glossitis. The correct option is median rhomboid glossitis. Patient with candidiasis that doesn't respond to nystatin therapy should be evaluated for the following except diabetes insipidus, diabetes mellitus, hyperparathyroidism, malignant lymphoma. The correct option is diabetes insipidus. Coming to multiple choice questions of cysts. Characteristic feature of odontogenic keratocyst, multilocular radiolucency, radiopic lesions, ground glass appearance, parakeratinized epithelial lining. The correct option is parakeratinized epithelial lining. Which of the following radiographic appearance of is characteristic of odontogenic keratocyst? Number A, well-defined radial opacity, well-defined radiolucency with smooth margins or smooth borders. Option 3, ground glass appearance and onion skill periosteal reaction on radiograph. The correct option is well-defined radiolucency with smooth borders. How is an odontogenic keratocyst typically diagnosed? Percussion, blood tests, saliva tests, clinical examination and radiographic findings. The correct option is clinical examination and radiographic findings. Common symptom of an odontogenic keratocyst: painless swelling, severe pain, gingival bleeding, tooth mobility. The correct option is painless swelling. Which histopathological feature is characteristic of odontogenic keratocyst? Multinucleated giant cells, keratinized epithelial lining, necrotic bone, pseudocyst. The correct option is keratinized epithelial lining. Initial management approach for odontogenic keratocyst: radiation therapy, observation and monitoring, chemotherapy, surgical enucleation and curettage. The correct option is surgical enucleation and curettage. Which is common issue with odontogenic keratocyst after treatment? No risk of recurrence, low recurrence rate, high risk of recurrence, and it is malignant. The correct option is high recurrence rate. Which condition should be included in differential diagnosis of odontogenic keratocyst? Ameloblastoma, osteosarcoma, fibrosis dysplasia, all of the above. The correct option is all of the above. Common complication of untreated odontogenic keratocyst: oral candidiasis, increased tooth mobility, pathological features, geographic tongue. The correct option is pathological fractures. Which factor commonly significantly affects the prognosis of odontogenic keratocyst? Complete surgical excision, tooth color, frequency of dental cleaning, type of toothbrush used. Correct option is complete surgical excision. Thank you.